This paper does something very interesting. It's using a nasal spray of anti-COVID antibodies, and this is combined in with an adjuvant of hypermellulose or hydroxypropyl methylcellulose, same thing, different names. And what they found is that the nasal spray with these targeted antibodies significantly and broadly neutralized COVID. However, the significance of the effects were highly dependent on the COVID variant. And this study was performed a little differently. They were using 38 healthy volunteers, meaning these individuals were not infected with COVID. So, to actually perform their tests, they collected nasal fluid, and they did this by swabbing both nostrils before, immediately after doing the spray, and then 6 hours after doing the spray. And in addition to testing their nasal spray, they also used a placebo control of saline. And then between the saline and the antibody spray groups, they then added COVID to the collected nasal fluid and then tested its inhibition to COVID. So here's their placebo, that saline spray before and after spray, and they found no statistically significant difference, showing that this did nothing to disrupt the COVID viral levels, while alternatively their nasal spray with the antibodies, before the spray it was very low signal inhibition, and then after the spray it had very high signal inhibition. And then more interestingly, when we look at 6 hours later, with that saline spray there's no difference between groups. While it is trending up on average, it doesn't reach statistically significant levels. However, for the nasal antibody spray, we're seeing a sustained effect at the 6 hour time point. And we see the exact same trends that I just explained for both Delta and Omicron. And what I really want to highlight from this is that when you're sick with COVID, when you have an active COVID infection, you want to use something that has a staying effect and will actually inhibit or kill the virus, as opposed to something like saline that just has a flushing effect. As by using something that inhibits the virus, this is going to reduce transmission, this is going to reduce symptoms, and this is going to reduce your infection duration. Putting some numbers to what I just showed you, immediately after the nasal antibody spray, neutralization was around 92%, and then this remained high 6 hours after at about 71%. And part of the success of this is by using the adjuvant of the HPMC, because it acts as a viscosity enhancer, which helps to extend the retention time of the antibodies in the nasal cavity by reducing mucociliary clearance. Additionally, HPMC as a nasal spray has demonstrated effectiveness in inhibiting COVID infection by forming a gel matrix and reducing virus release by over 99.99% at a specific dose in cell culture. Targeted antibodies and this HPMC compound sort of work together to provide this. Where again, I want to emphasize that this is really good during a COVID infection, but it likely wouldn't act as a good intranasal antibody prophylaxis, meaning as a preventative measure, because the widespread use of something like this and the long-term administration of antibodies into your nasal cavity can provide challenges because it's very expensive to produce, and it likely isn't going to be good to have a prolonged, sustained inflammatory immune response in your nasal cavity that's being induced by this nasal spray. So as I've been saying and harping on for a little bit now, you have to use the right thing at the right time. There are some tools that work better as a prophylactic, as a preventative measure, and there are other more aggressive tools that you want to use when you have an active COVID infection, and this not commercially available nasal spray would be one of those more aggressive measures.